Hi folks, here's another video on the muscles, this time of the neck, the back, and the shoulder and chest. So these are muscles that are working to move the shoulder or move the head of the humerus around the back or the chest. Okay, so again, I'm gonna start here with the zygote body, and then we'll kind of switch over to Get Body Smart to take a closer look at these origins and insertions and mechanisms of action or actions. And I'm also using, again, the textbook table in the tables in chapter 11 to check out the origins, insertions, and actions, as they're summarized pretty well there. And I should say there's mostly complete overlap, almost complete overlap between what you find in the textbook and what you find on Get Body Smart in terms of those origins, insertions, and actions. Sometimes there are just minor differences, and where those exist, either whatever you put down, if I ask you for an action, is fine as long as it exists in one of those places. Okay, so the first one is the trapezius. You can see that here we've got our human, we're on the back. The trapezius is a superficial muscle. It's this one that has four sides, right? Like a trapezoid. So you've got 1, 2, 3, 4 sides. That's a trapezius. It's got broad origin and a number of insertions. You can see kind of the border of it there, right? And then the origins kind of all along the vertebrae. So we'll look at that one in a little more detail in a minute. The levator scapulae. Let's see if we can find our levator scapulae. And that one's, there we go. Levator, oh, okay. They're calling it the levator scapularis, but it's the same thing, right? So there's our levator scapularis or levator scapulae. It basically elevates the scapula, right? So the origins here, the insertions here. We'll take a look at that one as well. But I want you to see all these on the muscle, the full body model before we go and look at them in more detail. The rhomboid major and minor. So these are actually deep muscles. They're not terribly deep, but they are underneath the trapezius. So if we just take off the trapezius here, then we can see our rhomboids, right? So here's our major, right? It's the big one. So just like our zygomaticus major and minor, right? This is the major, this is the minor. So the minor is above the major, but this is the largest one, right? And you can see here that the origin is on these vertebral spinous processes, and the insertion points for both of these are on parts of the scapula, and it's looking like the medial portion of the scapula. The serratus anterior. This is good that we've taken off the trapezius. Actually, we can put that back on, but we want to take off another one, a big superficial muscle, the latissimus dorsi, to see the serratus anterior. But maybe before we do, this is the latissimus dorsi here. It's a big kind of fan-shaped muscle. You can see its origins all over here, a lot of origins, and inserting this huge muscle with these big origins is inserting just on the anterior portion of the humerus, right? So just inserting on the anterior portion of the humerus. We'll take a look at that one soon. Let's get rid of this one though, so we can see the serratus anterior. So here's our serratus anterior. All of these are serratus anterior. They're inserting, so they're originating on these ribs, and then they're inserting on the scapula, and this is trying to show you that they're inserting on the anterior portion of the scapula. So they're not wrapping around the back of the scapula. They're actually inserting on the anterior side and on the medial margin of the anterior side. So we'll take a look at those two. We've got our, let's see, what are we missing? Oh, the deltoid. Okay, so the deltoid is this big muscle here on either side, right? This is our deltoid. So the deltoid is originating here all across the scapula and clavicle, and then inserting on the deltoid tuberosity of the humerus, right? So this is another muscle it ends up being a multipinnate muscle. It has multiple heads to it and one big kind of large insertion point. That's our deltoid. That's a superficial muscle. Then we have the muscles of our rotator cuff. So we're going to have to take off some muscles to see these. The muscles of the rotator cuff basically hold the humerus into the glenoid fossa of the scapula and perform small actions around it. So we've got to take off our deltoid as well. Sorry. In order to see these. The first is the supraspinatus, and these are the ones that are easy to see and on the dorsal side are the supraspinatus, the infraspinatus, and the teres, most of the teres major and minor. Sorry. Here we go. Okay, that's gone. Now, here's our here's our scapula, right? You can see the spine of the scapula. This is the infraspinatus, right? It's underneath the spine of the scapula. It's originating on the infraspinous fossa. That's the infraspinatus. You can see then it's inserting on this outer margin of the humerus, just sort of behind the greater, kind of on the greater tubercle. Then we've got the supraspinatus, right, in the suprascapular fossa, right? So there's our supraspinatus, also there inserting on the outer edge, that's sort of top and outside of the humerus. So we'll look at the exact insertion points in just a moment. And then we have our teres major and minor. Here's the major. It's quite large, right? You can see how large it is in comparison to the minor. So the teres major originating on the scapula. And this one actually comes around to insert on the front of the humerus, right? So you can see it inserting there on the front of the humerus. And then our teres minor is having a similar origin, but then inserting on the back of the humerus, the posterior portion of the humerus here. And then we have our subscapularis, which is probably the toughest one to see. So this one, we might have to take off everything in order to see it. This one has its origin on the subscapular fossa. So there it is, I believe. Yeah, subscapularis. Wow, we had to dig for that. Right. So it has its origin on the subscapular fossa, the anterior portion of the scapula, and it's inserting, sorry, there we are. It's inserting on the anterior portion of the humerus as well. Okay, so those are all the muscles of the rotator cuff: the supraspinatus, infraspinatus, subscapularis, teres major and minor. And then finally, we got to do the chest. That's the pectoralis major and minor. Well, there's the pectoralis major right there. Okay, you can see this broad origin here, and then this insertion on the humerus just below the sulcus, right? So that's the pectoralis major, and underneath it is the pectoralis minor. Let's get rid of that. And you can see the pectoralis minor originating on these true ribs here, and then we go inserting on the coracoid process of the scapula, right? So that's our pectoralis minor. Okay, let's look at these a little more closely in Get Body Smart. We'll start with the, no, let's start with kind of where we began, with the trapezius, right? So here's our trapezius muscle. This is just going to allow us to peel all the layers away and see the insertion and origins pretty easily, and the actions. So there's our trapezius. If we pull all these other muscles away, we can see it's overlying all the muscles of the rotator cuff. It's a really large muscle, right? And we can see broadly its origin and insertion points. But now let's take a look at these more closely. Origin all along the spinous processes of the vertebrae, from thoracic to lumbar, or from cervical to lumbar, even an origin on the occipital bone. And then the insertion points are all across the spine of the scapula and the clavicle. So we have it kind of wrapping around both wrapping around both sides, the spine of the scapula and the clavicle. So because of that, and because it has so many origins, when it pulls on these, it can have a number of things can happen. It can certainly elevate the scapula, right? So it can elevate when this portion, right, its origin is here on the occipital. When it pulls, it can elevate the scapula. It can also rotate the scapula upward. So upward rotation of the scapula via those same contractions. There's an upward rotation is primarily this, but also this portion, right, where it's inserting on the spine and originating on the spinous process. So a little upward rotation of the scapula. It can extend the neck, right? So there's a neck extension, leaning your neck back, right? Again, these primarily this part of the muscle firing. And it can adduct the scapula, so it can pull the scapula in towards the midline of the body, adduct the scapula, right? So that's adduction, right? There is adduction. So all of these firing will adduct it, and it can even lower, when we get this portion firing, lower um, the scapula, so it pulls it down. So lowering the scapula. So it's responsible for all of these movements you're able to do here, pulling your shoulders back, pulling them up, pulling it down. That's all the trapezius. Even a little bit of, upward. Well, we already sort of saw this upward rotation, right? All right. That's our trapezius. Then let's see our levator scapulae. Okay, whoops. Let me go back. Here's our levator scapulae. We got to peel off all these layers to see it, but especially the trapezius. Now we can see the levator scapulae with its insertion here on the medial margin and top of the scapula. Right? So there's our levator scapulae. Right. So you can see this is when this muscle contracts, it's going to be drawing the scapula up in some way. Right. So our origin is here on these cervical vertebrae, right? And it's on the transverse processes of those cervical vertebrae, and then inserting on the superior angle here of the scapula on that medial border of the superior angle of the scapula. So the action here is elevating the medial border of the scapula, right? It can also pull, it can contribute with the trapezius into pulling the scapula medial, right, or adducting, and even in a little bit of bending of the neck, right? Okay, that's our levator scapulae. Now our rhomboids major and minor. Let's do our rhomboid major here and pull off all these layers. Oops. There's our major and our minor, right? So the spinous processes of the thoracic vertebrae, T2 to T5, that's the rhomboid major, that's its origin. And then the insertion is, again, the medial border of the scapula, but inferior to the spine rather than superior to the spine. So medial border inferior to the spine. And primarily retracting the shoulder. That's a major function, is pulling the shoulder in towards the medial part of the body, towards the spine. And then a bit of elevation as well of the medial border, while it sort of laterally rotates this whole thing. So there's elevation of the medial border here, and this lateral rotation, or sort of not lateral, sorry, more of a downward rotation. If anything, the angle here is medially rotating. Okay. Then we have the minor. being just above, right? There's our minor just above, and it has just a smaller origin and insertion. So the spinous processes of that terminal C7 vertebrae and T1, that's the origin, the insertion on the medial border. But this is superior to the spine, so kind of like our serratus, or sorry, our levator scapulae inserting on this medial border superior to the spine. And um, good at retracting that medial border of the scapula. Right, so you're sort of pulling in, retracting that medial border of the scapula. It also does a bit of elevation, kind of similar thing to what the rhomboid major does, right? So it's that elevating the medial border. Okay. Our pectoralis, did we do our serratus anterior yet? We did. Yes. Did we? My gosh. I don't know if we did. We didn't peel these off, did we? No. Okay. Let's look at our serratus anterior. So here it is originating on these true ribs, even on a couple of false ribs there. And so it depends, but first 8 or 9 ribs, and then inserting on the anterior surface of the medial border of the scapula. So remember, this is the anterior surface here where we have our subscapularis. This is the medial border. So it's inserting, or sorry, inserting there. So let's take a look. Yeah, there we go. So these are all the origins in red, the insertion there in blue. So this is helping to abduct the scapula. So can pull it out, right? So abduct rather than adduct or retract, but sort of protracting, right? There it is, moving it out. And here's another look, right? This now having kind of the same action as we saw with the rhomboids, right? Or contributing to that same action, but via a different mechanism. This is because these fibers are now pulling on this anterior medial border, right? And pulling it forward, right? Okay. So a bit of upward rotation, a bit of abduction for the serratus anterior. Let's look at the pectoralis major and minor. So here's our pectoralis major. And we can pull it away and see, right, there's our big kind of fan-shaped convergent pectoralis major. Few different origins here, kind of the clavicle, the kind of medial half of the clavicle, and then the sternum, right, the upper costal cartilages of the sternum, and then inserting on just lateral to that intertubercular groove and the greater tubercle of the humerus, right? So there's our little intertubercular groove here. We're just lateral to it, and here's the greater tubercle up here. We're just kind of barely touching the greater tubercle, right? So there's our insertion. There's our broad origin. So it's definitely contributing, given that this is our origin, to pulling this bone, this humerus forward, right? So flexion of the arm. So here's our flexion of the arm at the shoulder, right? Moving it up. It's contributing to that motion, as well as extension of the, extending the arm from this flexed position. So because of this not odd, but this big fan shape to it, because it has muscles, fibers going in many directions, it can both contribute to pulling it up, right? When these muscles fiber, as well as contribute to pulling it back when the alternative muscles fibers fire. And then if they both work together, it kind of rotates the arm medially. So there's medial rotation of the arm because they're both pulling, right? They'd both be pulling on this at the same time, kind of rotating that inward. And then a little bit too, if the arm is out, right, like this, it can contribute to adducting the arm as well, bringing it in towards the body. And you can see that, right, if the arm is out and these fire, it's going to pull this down, right, toward the midline of the body. Okay, let's do now our pectoralis minor. Yeah. So here's our pectoralis minor. We'll pull that pectoralis major off, and you can see the origin here on these ribs, not the costal cartilage of the ribs, but actually on the ribs themselves, and the insertion on this coracoid process of the scapula, right? So there it is. This is ribs 3 to 5. The anterior surface of ribs 3 to 5 is the origin, right? And the insertion is that coracoid process of the scapula. So this actually is an important muscle in breathing, as well as, so in basically raising the rib cage, but it also contributes to drawing the scapula forward and down. So a bit of like basically medial rotation of the arm, but it's really medial rotation of the whole shoulder, right? Of the entire scapula, not just the humerus itself, right? Like you can imagine medially rotating the humerus or doing that with the scapula. Okay. Let's do our deltoid next. So here's our deltoid with everything pulled away, right? With big broad origin here and a small insertion origin on the clavicle and the scapula, on the acromion process and spine of the scapula. So we've got the anterior lateral surface of the clavicle and the acromion and spine of the scapula. So a pretty broad, right, triangular shaped insertion origin, and the insertion on the deltoid tuberosity of the humerus, which we've seen before. So here again, we can see all across here, and then it would really be on the back of the spine of the scapula as well. We are only seeing the front of the acromion, but right, it would be, yeah, we're only seeing the front of the acromion, but it would be on the spine of the scapula back as well, and then on the clavicle. So this is primarily an adductor and a flexor, a bit of rotation. So here it's the anterior portions of the muscle help to flex the arm. It also does a bit of medial rotation at the shoulder joint, and an abduction of the arm is another major action, right? As it's pulling just laterally on that greater tubercle. Let's do the latissimus dorsi next. Pull these away and see this broad origin of the latissimus dorsi to a tiny little insertion on the anterior portion of the humerus, superior portion of the humerus. Let's look at all of these origins, right? The spinous processes of the last half of the thoracic vertebrae and the lumbar vertebrae, the iliac crest, right where it attaches to the sacrum, the end, let's see, the lower 3 or 4 ribs, and even a bit on the inferior angle of the scapula. So it's really a very broad origin for this muscle, and inserting basically just on the below the intertubercular groove of the humerus. So if we pull all these things off, we'll see all of these are origins, right? Here's the iliac crest, here's the sacrum and lumbar and thoracic vertebrae. Here are these lower ribs, and even a small bit of origin on the inferior angle of the scapula. And those are all wrapping around to the front of the humerus to insert just below the intertubercular groove of the humerus. So this one has some interesting, some functions that are maybe a little hard to think of, but if you realize that this thing is wrapping from back to front, then anytime it's contracting, it's going to be pulling this humerus backward and inward, right? So backward and medially, pretty much. So it's doing a little bit of it's doing some adduction. If the arm is out here, it does contribute to adducting the shoulder because it's pulling on that superior portion of the humerus. It also medially rotates the arm, again, because it's wrapping from back to front, right? It's wrapping from the back all the way to the front. So any contraction that shortens it is going to pull the front of the humerus in along the angle that it's wrapping. So, right, it's wrapping from here up to here. So you shorten that, you're going to be yanking on the front of the humerus and medially rotating it, and then extending the arm at the shoulder. In addition to that medial rotation, you also get it pulling the arm back. So extension of the arm is that backward motion of the arm. Okay, so that's the latissimus dorsi. And then we have our muscles of the shoulder cuff. So remember that these muscles basically hold the humerus into the glenoid fossa of the scapula. So we'll start with the subscapularis, this kind of tricky one that's on the anterior portion of the scapula. So we have to pull everything away, and there it is. Right? This is the subscapularis and the subscapular fossa. So it's originating on more or less this medial border of the scapula anteriorly and inserting just to the medial to the intertubercular groove, basically on the lesser tubercle of the humerus, right? So we can, so we can see here the subscapular fossa of the scapula, and then insertion on the lesser tubercle of the humerus. That'll show us origin, insertion, right? So again, when we pull on this, it's pulling the humerus in toward the glenoid fossa, getting perhaps a bit of medial rotation, but it's primarily a fixator, right? So it's a little bit of medial rotation, but mostly it's just fixing the humerus in there to the scapula. How about supraspinatus, right? This is another one. Sorry, we'll take off the trapezius, and here's our supraspinatus above, right? Supra above the spine of the scapula. So there's a origin in inserting out here, right? So on the kind of lateral border and posteriorly. So the supraspinous fossa of the scapula is the origin, and the insertion is the greater tubercle, kind of superior portion of the greater tubercle of the humerus. So if we pull all this off, there's our origin, there's our insertion. So again, primarily a fixator, right? Pulling this in, but also a bit of an adductor. So when you pull on this muscle, contract this muscle, it pulls on the outside of the humerus here. So it's going to adduct it. It's going to pull it up away from the body. So the abduct, I hope that's what I said, abduct, pulling it away from the body like that. Okay, then we have our infraspinatus. Now this is again on the back, right? We'll pull all that away. That's the supra, that's the infra. So it's on the infraspinous fossa of that scapula, right? That's the origin of it. So there's our infraspinatus, and inserting on the middle part of the greater tubercle of the humerus. So very close to the supraspinatus, right? But this is sort of the medial portion rather than the superior portion of that greater tubercle. So here we are with our origin, infraspinous fossa, insertion. So here again, primarily a fixator, but you can probably guess that it's doing a little bit of lateral rotation of the humerus, right? So here's a little bit of lateral rotation of the humerus, right? It's contributing to a little bit to that, as well as being a fixator. And then we have our teres major and minor. Let's do that in order. So here's our teres major muscle. We'll pull everything off and see our teres major with its origin here and insertion on the front of the humerus just below that intertubercular groove. Here we go, the lower lateral border and inferior angle of the scapula. You know, if you just say scapula, medial, inferior border, you know, that's fine. and then insertion on the intertubercular groove, right? Yes, medial lip of the intertubercular groove, but okay, intertubercular groove is going to be fine for our purposes. You can still envision its action if you do that. So there's our origin, and then anteriorly there's our insertion. So again, this is another one that wraps around, sorry, from front to back, right? So wrapping around from the back over here to the front. So you can guess when when it contracts, it's going to be medially rotating this humerus again. So its action, there's going to be a few. Certainly, if the arm is out, it can adduct the arm. It contributes to that, but it's also a major medial rotator of the arm, right? And even a bit of extension of the arm at the shoulder. So extending it backward, right? And that's because, again, of this front to back, right, motion. More or less, the scapula is not moving, and so when this muscle shortens, it's going to immediately rotate the humerus, draw it back, and of course, if it's out here, it's going to pull it towards the scapula. Okay. And then finally, our teres minor, right? So you know that one's originating not on the medial, but now on the lateral border of the scapula, and again inserting on the humerus, but it's on the back of the humerus, the posterior portion of the humerus. So this is on the lateral border of the scapula, its origin and insertion on the very lowest portion, inferior aspect, right? So you can just say the inferior greater tubercle of the humerus, right? There's the greater tubercle, so just inferior to that. And then we'll see that here. There's our origin and an insertion. So again, I'm mostly a fixator, but you can guess it's also adducting the arm. If the arm is out, it's going to adduct the arm, and also going to do a little bit of lateral rotation, just like the infraspinous. Infraspinatus does. It's going to do a little bit of lateral rotation of the arm. So here's our little bit of lateral rotation, and if our arm is out, right, we're going to be adducting the arm, right, moving it from out in towards the body. Okay, that is it for all those muscles of the back, shoulder, and chest. I will do another video for you here soon for the arm and forearm, or the upper arm and forearm. Please let me know if you have any questions about this.